Hello, Dr. Caroe.
Corinna, hi, how you doing?
Hello.
Do you want to show me this thing that's worrying you?
So this is the area where we wanted you to see. Is this mole here, which Margaret described it as being very itchy.
Corinna, can you just get a bit closer to that?
Yes, I can go closer if you want me. Is that better?
Alright, that looks okay. Can you see that bit? That is actually quite reassuring for me, and I think that's where I'd like you to put the cream, just there.
Brilliant.
If you do that twice a day on that spot, I think that'll be okay. If it's not, then just let me know and we'll hook up again and have another look.
Lovely. Thank you very much.
So one of the reasons I became a GP was to make a difference for people. I genuinely want to, on the day that I retire, to look back and say, I made a difference to that person. I made a difference to that county. And for me, this See What I See project is part of that progression.
See What I See is a really exciting project that we're doing in partnership with the Academic Health Science Network across Kent, Surrey, Sussex, whereby a GP can remotely assess a patient in a care home. So the care home practitioner would be wearing some head-mounted technology, which effectively are glasses with a camera built into them. And as they assess the patient, which they can do hands-free because they're wearing the glasses, that's beamed back to the GP in his practice, so he can do the assessment remotely without having to travel to the care home.
So I've got a desktop with my screen, and just sitting on top of the screen, I've got my webcam. And that's all I need. So really from this end, there's nothing special. All the clever stuff happens up at the nursing home. So they've got a pair of Google glasses, they put them on, and they're connected to a laptop wirelessly, and on the laptop is a picture of me.
And I will just have to look to the patient, and the GP will see what I see.
If you have a look at this bit here, see I'm drawing on it. Can you see that bit? That is actually quite reassuring for me, and I think that's where I'd like you to put the cream, just there.
The resident will hear everything what is discussing there, so he's aware, and also can be a conversation between the resident and the doctor.
So that enables the GP to do that assessment without leaving his practice where that's appropriate. So that's really helping speed up assessment waiting times, and then if appropriate, that'll speed up the treatment and care for that patient, and also helps the GP in managing their workload, because we know our GPs are under a lot of pressure.
As a GP, I try and make every minute count of my day, and one of the least productive moments of my day is when I'm sitting on my bottom in a car. And when you're going in traffic and you're stuck and you're spending 20, 25 minutes getting somewhere and coming back again, actually that's an hour of doctor time. And the richness of what one can do in that time really for me is one of the key benefits that See What I See can bring.
So the reason I think this is exciting is because it brings those teams together to really benefit residents within the care homes. And we know that the quicker people are seen, then the more likely people are to have better health outcomes and get the treatment they need as soon as possible.
People in nursing homes are by definition frail, and we know that with frailty, things that are small problems can very quickly become big problems. And when you manage to deal with those things early, then that can nip other things in the bud.
We started in France in ambulances. In France, the first arrivers can actually share their vision with the doctor that is coming, but also with the regulation, so that the triage is done properly, that the patient is sent to the right hospital, and that the proper rooms and corresponding doctors are prepared before the patient arrives. We think that in 5 to 7 years, we'll look back and wonder how we used to do things without this type of technology.
And my hopes, sort of once we finish this project, is that we're able to, to spread that learning, and that we'll actually find other opportunities where the glasses could be used, in different settings.
I would like to see this See What I See project as really the beginning. It's a first step. There are so many wonderful ways in which we could use this. The health service at the moment is in a difficult situation, and it doesn't need a rocket scientist to know that there's a difficulty with resources. And some people think of that as the end game. And I see that as an opportunity. No, we can't absolutely carry on the way we've been doing things before, but let's see that as a way to open up the future, not as a way to think, oh, you know, things are broken and we can't carry on. We have an opportunity to say, let's do things differently, and the See What I See project is very much part of that.